Question 1. A practical nurse, PN, is caring for a client newly diagnosed with type 2 diabetes. Which of the following is the most important initial teaching point regarding foot care? A. Inspect feet daily for cuts, blisters, or sores. B. Soak feet in warm water for at least 30 minutes daily. C. Apply lotion liberally between the toes to prevent dryness. D. Wear open-toed sandals to allow air circulation. Answer: A. Inspect feet daily for cuts, blisters, or sores. This question tests knowledge of essential client education for diabetes management, specifically focusing on preventative foot care. The keyword "most important initial teaching point" indicates a priority action to prevent complications. Daily inspection of the feet is crucial because individuals with diabetes often have reduced sensation, neuropathy, and poor circulation, making them prone to unnoticed injuries and infections that can lead to severe complications. For example, a small blister could progress to a non-healing ulcer if not detected early. Remembering to prioritize daily self-assessment helps prevent serious diabetic foot complications. Question 2. A practical nurse, PN, is reviewing the medication administration record for a client. The PN notes an order for morphine 2 mg 4 PRN for pain every 4 hours. The client reports pain as 7/10. What is the PN's priority action? A. Administer the morphine as ordered. B. Assess the client's respiratory rate and level of consciousness. C. Notify the physician immediately due to the high pain score. D. Offer alternative comfort measures first, such as repositioning. Answer: B. Assess the client's respiratory rate and level of consciousness. This question evaluates the PN's understanding of safe medication administration, particularly for opioids. The keyword "priority action" highlights the need for a crucial assessment before administering a medication that can cause respiratory depression. Before giving an opioid like morphine, it is essential to assess the client's baseline respiratory status and level of consciousness to ensure it is safe to administer and to monitor for potential adverse effects. For instance, if the client's respiratory rate is already low, administering morphine could dangerously depress it further. Always remember to assess your client's baseline vital signs, especially respiratory rate, before administering opioids. Question 3. A client is admitted with a suspected urinary tract infection, UTI. The practical nurse, PN, collects a midstream urine sample for culture and sensitivity. Which action is essential to ensure the accuracy of the sample? A. Collect the first voided urine in the morning. B. Have the client drink a large amount of water before collection. C. Instruct the client to clean the perineal area thoroughly before voiding. D. Use a sterile catheter to obtain the sample for all clients. Answer: C. Instruct the client to clean the perineal area thoroughly before voiding. This question assesses the PN's knowledge of proper specimen collection techniques for a midstream urine sample. The phrase "essential to ensure the accuracy" points to the critical step that prevents contamination. Thorough cleaning of the perineal area before collecting the midstream portion helps remove microorganisms from the skin that could contaminate the sample, leading to inaccurate culture results. For example, if the area is not cleaned, skin bacteria could be identified as the cause of infection when they are merely contaminants. Always emphasize proper cleaning to get a true representation of the urine's contents. Question 4. The practical nurse, PN, is caring for an older adult client who is confused and repeatedly tries to get out of bed unassisted, despite being at high risk for falls. Which intervention should the PN implement first? A. Apply wrist restraints to prevent falls. B. Place a "do not fall" sign above the bed. C. Orient the client to their surroundings and ensure basic needs are met. D. Request a sedative medication order from the physician. Answer: C. Orient the client to their surroundings and ensure basic needs are met. This question focuses on fall prevention and caring for confused clients, emphasizing person-centered care and least restrictive interventions. The keyword first indicates the initial priority. Before resorting to restrictive measures, the PN should address underlying causes of agitation or confusion and ensure the client's comfort and safety. For example, the client may be trying to get out of bed because they need to use the washroom, are uncomfortable, or are disoriented. Always start with non-pharmacological, least restrictive interventions to promote safety and dignity. Question 5. A practical nurse, PN, is providing discharge teaching to a client with a new colostomy. Which instruction is most important for the PN to include? A. Change the colostomy appliance daily. B. Restrict fluid intake to prevent watery stool. C. Report any changes in stool consistency to the healthcare provider. D. Empty the colostomy pouch when it is 1/3 to 1/2 full. Answer: D. Empty the colostomy pouch when it is 1/3 to 1/2 full. This question tests the PN's knowledge of essential client education for colostomy management. The keyword most important highlights a crucial practical skill for preventing complications and maintaining client comfort. Emptying the pouch when it is 1/3 to 1/2 full prevents the pouch from becoming too heavy, which could cause it to pull away from the skin, leading to leakage, skin irritation, and potential infection. For example, a heavy, overfilled pouch is more likely to detach, causing embarrassment and requiring an immediate appliance change. Regular emptying maintains adhesion and skin integrity. Question 6. A client receiving an intravenous 4 infusion reports pain, swelling, and redness at the 4 insertion site. The practical nurse, PN, observes a palpable cord along the vein. What complication should the PN suspect? A. Infiltration. B. Phlebitis. C. Fluid overload. D. Air embolism. Answer: B. Phlebitis. This question assesses the PN's ability to identify complications related to IV therapy based on characteristic signs and symptoms. The specific cluster of symptoms, pain, swelling, redness, and a palpable cord along the vein, are classic indicators of phlebitis, which is inflammation of the vein. Infiltration involves fluid leaking into surrounding tissue, typically causing swelling and coolness, but not necessarily a palpable cord or significant redness along the vein. For instance, if you see a red streak and tenderness along the path of the vein, you should immediately suspect phlebitis. Always remember to assess 4 sites regularly for these key signs of inflammation. Question 7. A practical nurse, PN, is preparing to administer medication to an older adult client. Which age-related physiological change should the PN consider when planning medication administration? A. Increased gastric motility. B. Enhanced liver metabolism of drugs. C. Decreased kidney function. D. Increased lean body mass. Answer: C. Decreased kidney function. This question focuses on the physiological changes in older adults and their impact on medication pharmacokinetics. The keyword age-related physiological change directs you to consider how the body processes drugs differently in the elderly. As people age, kidney function often declines, which can lead to a reduced ability to excrete medications from the body. This means drugs can accumulate in the system, increasing the risk of toxicity and adverse effects, even with normal doses. For example, a medication that is normally cleared quickly by the kidneys might stay in an older adult's system much longer. Always remember that reduced kidney function in older adults means medications may need to be dosed lower or less frequently to prevent toxicity. Question 8. The practical nurse, PN, is assisting with the admission of a client who identifies as Indigenous. To provide culturally safe care, what is the most appropriate action for the PN? A. Provide the client with a list of indigenous cultural practices. B. Assume the client prefers traditional indigenous healing methods. C. Ask the client about their cultural preferences and spiritual needs. D. Discuss the importance of adhering to Western medical treatments. Answer: C. Ask the client about their cultural preferences and spiritual needs. This question addresses the concept of culturally safe care, which is vital in Canadian nursing practice, especially when caring for Indigenous clients. The phrase, most appropriate action to provide culturally safe care, highlights the need for a client-centered, non-assumptive approach. Culturally safe care involves actively listening to the client and understanding their unique cultural beliefs, values, and preferences, rather than making assumptions. For instance, some Indigenous clients may appreciate the option to involve elders or traditional healers in their care, while others may not. Always remember to engage in respectful dialogue to understand each client's individual cultural needs. Question 9. A client is experiencing acute shortness of breath and wheezing. The practical nurse, PN, assesses the client's vital signs and notes an oxygen saturation of 88% on room air. What is the PN's immediate priority intervention? A. Administer a prescribed bronchodilator by nebulizer. B. Elevate the head of the bed. C. Apply supplemental oxygen as ordered or per standing protocol. D. Notify the physician immediately. Answer: C. Apply supplemental oxygen as ordered or per standing protocol. This question tests the PN's ability to prioritize interventions for a client in respiratory distress. The words immediate priority and the low oxygen saturation, 88%, point to the most urgent action. Applying supplemental oxygen is crucial to improve oxygenation and alleviate hypoxia, which is a life-threatening condition. While other actions like elevating the head of the bed or administering a bronchodilator are important, increasing oxygen delivery directly addresses the immediate threat to the client's oxygenation. For example, if a client is visibly struggling to breathe and has low SpO2, providing oxygen is the first step to stabilize them before investigating further. Remember, oxygenation is often a top priority in respiratory emergencies. Question 10. A practical nurse, PN, is caring for a client with a nasogastric, NG, tube inserted for gastric decompression. Which assessment finding indicates the NG tube is functioning effectively? A. Client reports increased abdominal distension. B. Absence of gastric drainage in the collection canister. C. Audible bowel sounds in all four quadrants. D. Decrease in nausea and abdominal distension. Answer: D. Decrease in nausea and abdominal distension. This question assesses the PN's understanding of the expected therapeutic effects of a nasogastric tube for decompression. The keyword functioning effectively directs you to identify the positive outcomes associated with the intervention. The primary goal of gastric decompression is to relieve pressure, nausea, and vomiting by removing air and fluid from the stomach. Therefore, a decrease in nausea and abdominal distension indicates the tube is successfully achieving its therapeutic purpose. For example, if a client had severe bloating and felt sick, and after NG tube insertion they feel relief and their abdomen is softer, it shows the tube is working. Always remember the purpose of the intervention to identify its effectiveness. Question 11. A practical nurse, PN, is reinforcing teaching with a client who has iron deficiency anemia. Which food choice indicates the client understands how to improve iron absorption? A. Eating spinach with a glass of milk. B. Consuming an orange with an iron-fortified cereal. C. Drinking coffee with an iron supplement. D. Eating whole wheat toast with peanut butter. Answer: B. consuming an orange with an iron-fortified cereal. This question tests knowledge of dietary factors affecting iron absorption, a common teaching point for clients with anemia. The phrase improves iron absorption is the key. Vitamin C, ascorbic acid, found abundantly in citrus fruits like oranges, significantly enhances the absorption of non-heme iron, iron from plant sources and fortified foods. Conversely, calcium in milk and compounds in coffee can inhibit iron absorption. For instance, pairing an iron-rich meal with orange juice will boost the amount of iron your body actually uses. Always advise clients to pair iron-rich foods with a good source of vitamin C. Question 12. A practical nurse, PN, is providing wound care for a client with a stage 2 pressure injury. Which characteristic best describes a stage 2 pressure injury? A. Intact skin with non-blanchable redness. B. Partial thickness loss of dermis presenting as a shallow open ulcer with a red-pink wound bed. C. Full thickness tissue loss with exposed bone, tendon, or muscle. D. Full thickness skin loss with slough or eschar covering the wound bed. Answer: B. Partial thickness loss of dermis presenting as a shallow open ulcer with a red-pink wound bed. This question assesses the PN's understanding of pressure injury staging, a fundamental concept in wound care. The keyword best describes requires precise knowledge of the staging definitions. A stage 2 pressure injury involves partial thickness skin loss affecting the epidermis and/or dermis, often appearing as a shallow open ulcer with a red-pink wound bed, or a blister. Stage 1 is non-blanchable redness of intact skin, Stage 3 involves full-thickness tissue loss with visible fat, and Stage 4 involves full-thickness tissue loss with exposed bone, muscle, or tendon. For example, if you see a blister that has ruptured, revealing a pink base, you are likely looking at a Stage 2 pressure injury. Knowing these distinctions is vital for accurate assessment and care planning. Question 13. The practical nurse, PN, is reviewing the vital signs of a client admitted with dehydration. Which finding is most consistent with dehydration? A. Blood pressure 140/90 mmHg. B. Heart rate 60 beats/minute. C. Urine-specific gravity 1.035. D. Capillary refill less than 3 seconds. Answer: C. Urine-specific gravity 1.035. This question tests the PN's ability to identify key indicators of dehydration through vital sign and assessment findings. The phrase, most consistent with dehydration, directs you to the finding that best reflects fluid volume deficit. Urine-specific gravity measures the concentration of solutes in the urine. A normal range is typically 1.005 to 1.030. A specific gravity of 1.035 indicates highly concentrated urine, which is a strong sign that the kidneys are conserving water due to dehydration. For instance, when a client is dehydrated, their body tries to hold on to water, leading to more concentrated urine. Remember that a high urine-specific gravity suggests the client needs more fluids. Question 14. A client with a new prescription for warfarin, Coumadin, is receiving discharge teaching from the practical nurse, PN. Which food should the PN advise the client to consume in consistent, moderate amounts due to its vitamin K content? A. Oranges. B. Broccoli. C. Beef. D. White bread. Answer: B. Broccoli. This question assesses the PN's knowledge of dietary interactions with anticoagulant medications, specifically warfarin. The key phrase, consume in consistent, moderate amounts, relates to foods high in vitamin K. Warfarin's anticoagulant effect is directly impacted by vitamin K intake, which promotes clotting. Green leafy vegetables, such as broccoli, spinach, kale, and collard greens, are rich in vitamin K. Clients taking warfarin do not need to avoid these foods but should consume them consistently to maintain stable INR levels, as sudden fluctuations in vitamin K intake can alter warfarin's effectiveness. For example, if a client suddenly eats a large amount of kale after avoiding it, their INR could drop, increasing their risk of clotting. Teach clients to maintain a steady intake rather than completely restricting these foods. Question 15. The practical nurse, PN, is assisting a client with ambulation who has right-sided weakness. Where should the PN position themselves to provide the safest assistance? A. On the client's strong side, slightly behind. B. On the client's weak side, slightly behind, with a gait belt applied. C. Directly in front of the client, holding both hands. D. Behind the client, holding onto their clothing. Answer: B. On the client's weak side, slightly behind, with a gait belt applied. This question evaluates the PN's understanding of safe client transfer and ambulation techniques, particularly for those with unilateral weakness. The keyword safest assistance emphasizes fall prevention and proper body mechanics. Positioning on the client's weak side allows the PN to provide immediate support and leverage if the client begins to lose balance on that side, which is most likely. Using a gait belt provides a secure handhold, making the assistance safer and more effective. For example, if the client's right leg suddenly buckles, the PN is positioned to catch and support them. Always stand on the weak side and use a gait belt for maximum safety during ambulation. Question 16. A client in a long-term care facility develops sudden onset of confusion, increased urinary frequency, and a low-grade fever. The practical nurse, PN, suspects a urinary tract infection. What is the most appropriate initial action? A. Administer a broad-spectrum antibiotic. B. Increase oral fluid intake and monitor vital signs. C. Obtain a clean catch urine sample for urinalysis and culture. D. Reorient the client and encourage rest. Answer: C. Obtain a clean catch urine sample for urinalysis and culture. This question tests the PN's critical thinking regarding assessment and diagnostic procedures for suspected infections, especially in older adults where symptoms can be atypical. The words "most appropriate initial action" point to the necessary first step for accurate diagnosis. Obtaining a urine sample for urinalysis and culture is essential to confirm the presence of an infection and identify the specific causative organism, which guides appropriate antibiotic therapy. Administering antibiotics without a confirmed diagnosis is not best practice, and simply increasing fluids or reorienting doesn't address the suspected infection. For example, if an elderly client suddenly becomes confused, a UTI is a common cause, and a urine sample is needed to confirm it before starting treatment. Always collect necessary samples for diagnosis before starting treatment. Question 17. The practical nurse, PN, is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client states, "I'm so thirsty, can I just have a small sip of water?" What is the PN's best response? A. Yes, a small sip of water won't harm anything. B. I understand you're thirsty, but it's important for your safety that you don't drink anything before surgery. C. Let me check with the surgeon if you can have ice chips. D. You can have a sip, but don't tell anyone. Answer: B. I understand you're thirsty, but it's important for your safety that you don't drink anything before surgery. This question assesses the PN's ability to provide therapeutic communication and enforce safety protocols, specifically concerning NPO status before surgery. The phrase "best response" indicates the need for a reply that is both empathetic and firm about client safety. Explaining the rationale for NPO status, to prevent aspiration during anesthesia, while acknowledging the client's discomfort helps them understand the importance of compliance. offering sips of water or ice chips without a specific order or against general NPO guidelines could lead to serious complications. For example, drinking water increases the risk of stomach contents entering the lungs during anesthesia. Always prioritize client safety and provide a clear, empathetic explanation. Question 18. A client has a prescription for a subcutaneous insulin injection. Which site is most appropriate for the practical nurse, PN, to administer the injection for consistent absorption? A. Deltoid muscle. B. Ventrogluteal muscle. C. Abdomen. D. Vastus lateralis muscle. Answer: C. Abdomen. This question tests the PN's knowledge of appropriate injection sites for subcutaneous medications, particularly insulin, to ensure consistent absorption. The keyword "most appropriate for consistent absorption" is key. The abdomen is the preferred site for insulin injections because it offers a large surface area for rotation, has a consistent fat layer, and provides the most predictable and rapid absorption compared to other subcutaneous sites like the thigh or arm. Muscles are used for intramuscular injections, not subcutaneous. For example, if a client consistently injects insulin into the same small area, it can lead to lipohypertrophy and unpredictable absorption. Rotating within the abdomen provides the best consistency. Question 19. A practical nurse, PN, is educating a group of older adults about fall prevention at home. Which recommendation is most important for the PN to emphasize? A. Keep all rooms dimly lit to promote relaxation. B. Remove throw rugs and ensure adequate lighting. C. Avoid regular exercise to prevent fatigue. D. Always wear loose-fitting clothing and slippers. Answer: B. Remove throw rugs and ensure adequate lighting. This question assesses the PN's knowledge of environmental modifications for fall prevention in the home, especially for older adults. The phrase "most important for the PN to emphasize" indicates a high-impact intervention. Throw rugs are common tripping hazards, and inadequate lighting makes it difficult to see obstacles, steps, or changes in flooring, significantly increasing the risk of falls. Addressing these environmental risks directly removes common causes of falls. For example, a senior may trip over a small rug in a poorly lit hallway at night. Always recommend simple yet effective home modifications like these to reduce fall risk. Question 20. The practical nurse, PN, is caring for a client with newly diagnosed hypertension. The client asks, "What can I do to help lower my blood pressure without just taking pills?" Which lifestyle modification should the PN suggest first? A. Begin a rigorous strength training program. B. Eliminate all sodium from the diet. C. Engage in regular aerobic exercise, such as brisk walking. D. Drink at least 4 liters of water daily. Answer: C. Engage in regular aerobic exercise, such as brisk walking. This question assesses the PN's knowledge of non-pharmacological interventions for hypertension management. The words "suggest first" indicate the initial, most universally applicable and effective lifestyle change. Regular aerobic exercise, like brisk walking, has a well-documented effect on lowering blood pressure, improving cardiovascular health, and is generally safe and accessible for most individuals. While sodium reduction is important, eliminating all sodium is unrealistic and unnecessary. Rigorous exercise may not be suitable for all clients, and excessive water intake is not a direct treatment for hypertension. For example, even 30 minutes of brisk walking most days of the week can significantly contribute to lowering blood pressure. Encourage moderate, consistent physical activity as a cornerstone of hypertension management. Question 21. A practical nurse, PN, is assessing a client's pain level using a numeric rating scale, NRS. The client rates their pain as 8 out of 10. What is the PN's most appropriate action? A. Document the pain score and reassess in 4 hours. B. Administer a prescribed PRN analgesic and reassess the pain level after administration. C. Tell the client that an 8/10 is very high and ask them to reconsider. D. Encourage the client to distract themselves with an activity. Answer: B. Administer a prescribed PRN analgesic and reassess the pain level after administration. This question tests the PN's understanding of pain management principles and the importance of prompt intervention for high pain levels. The keyword "most appropriate action" signifies the need for a direct and effective response to severe pain. A pain score of 8 out of 10 indicates severe pain that warrants immediate pharmacological intervention if a PRN, as needed, analgesic is prescribed. After administering the medication, it is crucial to reassess the pain to evaluate the effectiveness of the intervention. For example, if a client reports severe pain after surgery, giving the ordered pain medication promptly and then checking if it worked is standard practice. Always take client-reported pain seriously and act on it swiftly according to orders. Question 22. The practical nurse, PN, is caring for a client experiencing dyspnea and orthopnea due to fluid overload. Which position would best facilitate the client's breathing? A. Supine position with legs elevated. B. Trendelenburg position. C. High Fowler's position. D. Prone position. Answer: C. High Fowler's position. This question assesses the PN's knowledge of therapeutic positioning to improve respiratory function, particularly in clients with fluid overload causing breathing difficulties. The keyword "best facilitate breathing" indicates the optimal position. High Fowler's position, sitting upright at 60 to 90 degrees, allows for maximum chest expansion and reduces the pressure of abdominal organs on the diaphragm, making it easier for the client to breathe and relieving dyspnea and orthopnea. Other positions like supine or Trendelenburg would worsen fluid accumulation in the lungs and increase breathing difficulty. For instance, if a client with heart failure is struggling to breathe while lying flat, sitting them upright will immediately provide some relief. Always remember that an upright position helps with respiratory distress. Question 23. A practical nurse, PN, is performing a routine skin assessment on an older adult client. Which finding requires immediate further investigation by the PN? A. Smooth, elastic skin. B. Presence of small, benign skin tags. C. An irregularly shaped mole with uneven color. D. Decreased skin turgor on the forearm. Answer: C. An irregularly shaped mole with uneven color. This question focuses on the PN's role in identifying potentially serious skin abnormalities, especially concerning malignancy. The phrase "requires immediate further investigation" indicates a suspicious finding. An irregularly shaped mole with uneven color, often described using the ABCDES of melanoma, asymmetry, border irregularity, color variation, diameter greater than 6 mm, evolving, is a classic sign of potential skin cancer. While other options describe common age-related skin changes or benign findings, a suspicious mole warrants urgent referral to a physician for biopsy and diagnosis. For example, if you notice a mole that has recently changed shape or color, it's crucial to have it checked out quickly. Always be vigilant for signs of skin cancer. Question 24. A practical nurse, PN, is caring for a client who is exhibiting signs of hypoglycemia, low blood sugar. What is the PN's initial action? A. Administer insulin as prescribed. B. Offer 15 grams of a fast-acting carbohydrate. C. Prepare to administer intravenous dextrose. D. Encourage the client to drink a large glass of water. Answer: B. Offer 15 grams of a fast-acting carbohydrate. This question assesses the PN's ability to recognize and respond to hypoglycemia, a common and potentially dangerous complication of diabetes. The keyword initial action points to the immediate intervention for a conscious client. For a conscious client experiencing hypoglycemia, the rapid administration of 15 grams of a fast-acting carbohydrate, like 4 ounces of juice, regular soda, or glucose tablets, is the standard and most effective initial treatment. Insulin would worsen hypoglycemia, and 4-dextrose is for unconscious or severely symptomatic clients. For instance, if a client on insulin starts sweating and feeling shaky, giving them a small glass of orange juice can quickly raise their blood sugar. Always provide fast-acting carbohydrates first for conscious hypoglycemic clients. Question 25. A practical nurse, PN, is teaching a client about proper hand hygiene. Which statement by the client indicates an understanding of the most effective method for reducing the spread of infection? A. I should use alcohol-based hand rub only when my hands are visibly dirty. B. Washing my hands with soap and water for at least 20 seconds is important. C. Wearing gloves means I don't need to wash my hands as often. D. A quick rinse under the tap is usually enough to clean my hands. Answer: B. Washing my hands with soap and water for at least 20 seconds is important. This question evaluates the PN's knowledge of infection control principles, specifically proper hand hygiene techniques. The phrase, most effective method for reducing the spread of infection, highlights the gold standard. Thorough hand washing with soap and water for at least 20 seconds is the most effective way to physically remove transient microorganisms and dirt from the hands, especially when hands are visibly soiled or after contact with bodily fluids. Alcohol-based hand rubs are effective when hands are not visibly dirty, but not as a substitute for soap and water when soiled. For example, after using the washroom or before eating, washing hands properly for 20 seconds is crucial. Always prioritize proper hand washing technique as the cornerstone of infection prevention. Question 26. A practical nurse, PN, is reviewing the medical record of a client with chronic obstructive pulmonary disease, COPD. Which of the following assessment findings is the PN most likely to observe? A. Bradycardia and hypotension. B. Clubbing of fingers and barrel chest. C. Increased appetite and weight gain. D. Hyperventilation with respiratory alkalosis. Answer: B. Clubbing of fingers and barrel chest. This question assesses the PN's understanding of the common, chronic physical manifestations of chronic obstructive pulmonary disease, COPD. The keyword most likely to observe directs you to characteristic signs of long-standing respiratory impairment. Clubbing of fingers, enlarged fingertips and curved nails, and a barrel chest, increased anterior-posterior chest diameter, are classic, chronic signs of COPD, reflecting prolonged hypoxemia and air trapping in the lungs, respectively. Bradycardia, hypotension, weight gain, and respiratory alkalosis are not typical chronic findings in COPD. For example, clients with severe COPD often develop these physical changes over many years due to the disease's progression. Recognize these as hallmark signs of chronic respiratory conditions. Question 27. The practical nurse, PN, is preparing to administer medication via a percutaneous endoscopic gastrostomy, PEG, tube. Which action is essential before administering the medication? A. Crush all medications into a fine powder. B. Mix all medications together in one syringe. C. Aspirate gastric contents to check for residual volume. D. Administer medications rapidly to prevent clogging. Answer: C. Aspirate gastric contents to check for residual volume. This question tests the PN's understanding of safe medication administration via a PEG tube. The keyword essential indicates a critical step for client safety and medication effectiveness. Aspirating gastric contents to check for residual volume helps assess gastric emptying and prevents complications like aspiration or medication malabsorption if the stomach is full. If a high residual volume is present, the medication may need to be held or the physician notified. For example, if the stomach is still full from a previous feeding, adding more medication could cause nausea or reflux. Always check for residuals before administering anything through a feeding tube to ensure safe absorption. Question 28. A client on a medical surgical unit suddenly becomes unresponsive and is not breathing. The practical nurse, PN, is the first responder. What is the PN's immediate priority action? A. Call the client's family. B. Initiate a code blue and begin chest compressions. C. Assess for a pulse and airway patency. D. Administer rescue breaths. Answer: B. Initiate a code blue and begin chest compressions. This question assesses the PN's knowledge of basic life support, BLS, and emergency response in a hospital setting. The keyword immediate priority action when a client is unresponsive and not breathing is to activate the emergency response system and begin chest compressions, following the CAB, circulation, airway, breathing, sequence for basic life support for lay rescuers/healthcare providers. While assessing for a pulse is part of the sequence, initiating the code and starting compressions is the rapid, combined response to cardiac arrest, ensuring timely, high-quality CPR and activation of advanced care. For example, if you find a client pulseless and apneic, the most critical initial steps are calling for help and starting chest compressions without delay. Always activate the emergency system and begin chest compressions immediately when cardiac arrest is suspected. Question 29. The practical nurse, PN, is providing education to a client about managing chronic pain. Which statement by the client indicates a need for further teaching? A. I should take my pain medication only when the pain becomes unbearable. B. I will try to keep a pain diary to track my pain levels and triggers. C. I understand that pain can affect my mood and daily activities. D. I can explore non-pharmacological methods like heat packs or gentle exercise. Answer: A. I should take my pain medication only when the pain becomes unbearable. This question assesses the PN's understanding of effective chronic pain management principles, focusing on prevention and consistent control. The phrase indicates a need for further teaching points to a misconception. Waiting until pain is unbearable before taking medication is ineffective for chronic pain management. It's often more challenging to control severe pain once it escalates, leading to less effective relief and increased suffering. Chronic pain is best managed by taking prescribed medications regularly or at the onset of pain as prescribed, along with non-pharmacological strategies, to maintain consistent pain control. For example, if someone waits until their arthritis pain is excruciating, it becomes harder to bring it back down. Teach clients to take medications proactively to prevent pain from becoming severe. Question 30. A practical nurse, PN, is reinforcing teaching on proper care for a client's central venous catheter, CVC, at home. Which instruction is most important to prevent infection? A. Change the dressing weekly, or if it becomes loose or soiled. B. Flush the catheter daily with saline without scrubbing the hub. C. Avoid showering completely to keep the site dry. D. Clean the skin around the insertion site with plain soap and water. Answer: A. Change the dressing weekly, or if it becomes loose or soiled. This question assesses the PN's knowledge of crucial infection prevention measures for central venous catheters in the home setting. The phrase, most important to prevent infection, highlights a critical aspect of CVC maintenance. Regular and appropriate dressing changes, particularly if the dressing is loose, soiled, or wet, are paramount for preventing bacterial entry and subsequent infection at the insertion site. Neglecting dressing integrity can quickly compromise the sterile barrier. For example, a soiled dressing provides a breeding ground for bacteria to enter the bloodstream. Always emphasize vigilant dressing care as a primary defense against CVC-related infections.